One of the toughest challenges for a healthcare marketer is ensuring that the patient experience is consistent across all the different touch points. That means website, the app, the call center, and the actual front desk. It's surprising how hard it is just to make sure that the phone number is the right one across all of those, let alone making sure that the brand colors and the tone of voice match everything in your guidebook. Hello, I'm Colin Hung, and joining me on the Sway Health program today are two people who are helping healthcare organizations achieve a consistent and, more importantly, an engaging patient experience. Drew Veach is a senior account manager at BizStream, and Sean Wright is the lead product evangelist at Kentico. You are going to love all the tips they share. Let's get to it.
Sway Health.
Drew, Sean, welcome back to the program.
Thanks, Colin. Happy to be here.
Yeah, thanks for having us.
Yeah, I'm excited to sit down with you. We're going to talk about one of my favorite topics, of course, patient experience, patient engagement. The two of you are at the forefront of that with all the work that you do. And we'll get more into that. But maybe just for those that maybe didn't tune in or to our last conversation or who don't know you, Drew, can you give us a little bit about you and tell us a little bit more about your role in your company?
Absolutely. Absolutely. I work at BizStream. We're a digital agency. We offer custom web development, content strategy, and UX UI design. And where we help with healthcare marketers, digital marketers, and professionals is by building digital tool sets and ecosystems that are going to make their content marketing efforts much, much easier. Me being a senior account manager, I'm on the forefront working with my clients, trying to assess what that scope is, what those needs are, and where we can be a better fit to make them more successful.
And Drew, you still have one of the best backgrounds ever when it comes to podcasts and for videos. So congrats on still being the king of that hill.
Thank you. I appreciate that. I appreciate that, man.
And Sean, over to you. Tell us a little bit more about your role over at Kentico.
Yeah, thanks, Colin. Hi, my name's Sean Wright. I'm lead product evangelist at Kentico, and Kentico is a MarTech software development company, and we create a digital experience platform for marketing teams to help them reach their customers across multiple digital channels.
Nice. I like everything you said there because it's all about reaching people where they are.
Yep.
Obviously, in this context, we're talking about patients, but your platform reaches consumers and customers everywhere, right? It's
Yep.
not just patients that you work with. So, well, welcome both of you to the program again. Let's dive right in. Both of you, since you deal with so many different customers, especially patients, what are the main challenges that you're finding in your conversations and in your travels that healthcare marketers in particular face when trying to engage patients through these digital channels that are available to us? Drew, maybe we'll start with you.
I think a couple of them that I have been seeing, a few things in that, Colin. Personalization within regulatory limits. Everybody wants to personalize healthcare. Everybody wants to receive personalized healthcare and personalized communication. How to do that within HIPAA without blowing up HIPAA and getting the privacy regulations that HIPAA provides and making offenses towards that. The other one, I think, is going to be adapting to some of the changing patient expectations. I think we've become smarter over the years with a lot of the online tools that we have. I think with WebMD that came out years ago, I think we've become elevated as patients to understand more right from the get-go. And understandably, WebMD doesn't solve everything. I know there's an argument that can be made that about its accuracy, and everybody's, a cyberchondriac at that point. But I think it provides a good baseline and education for people to start asking where they can start asking questions with their providers. And then I think really the third thing is consistency across channels, just interacting with multiple channels, websites, mobile apps, social outlets and channels. making it difficult and making it more seamless and consistent across all of those experiences.
Yeah, I like what you said there. There's definitely no shortage of channels, right? And every year there seems to be a new one that pops up that you must be on or you must be using because part of your segment, part of your population is on there. Personalization, you're right, absolutely right. Another hot topic, something that everyone wants, but to be honest, not everyone I don't think everyone has a consistent definition of what that really means. Like,
Exactly.
how do you know when you've gotten there, right? Kind of deal. But Sean, over to you. What are some of the challenges that you're seeing from your healthcare clients that you're working with?
Yeah, I completely agree with Drew. Marketing teams are being tasked with managing more and more digital channels, and not just digital channels, but really digital experiences, because the channel is just a vehicle to get that experience to the customer, or in the case of healthcare, to the patient. And the marketing team is responsible for more and more of that over time. And with that comes the challenge of meeting those patient expectations. If I'm using my healthcare mobile app on my phone, I want to be able to get the exact same information that's relevant to me there as I would going to the website or seeing something in an email. And if that information is inconsistent, or if those experiences aren't good, it's going to affect my ability to, one, engage with that healthcare provider, that system, but it's also going to degrade my trust in them and confidence that they're going to get things right. So if I see, for example, let's say a different address or a different Google Maps link telling me how to get to my provider's office in my mobile app compared to the website, which one am I going to choose? Am I going to feel confident about the experience I'm going to have with that healthcare system? Probably not. And marketers, it's their responsibility to make sure that that information and those experiences for patients are great. One, so that the patient can get quality healthcare and have a quality experience, but also to maintain the reputation that marketing team is responsible for the overall organization.
I like what you touched on there, Sean, because Drew mentioned it in his comment around consistency across channels. You're talking about something that there's certainly consistency of voice, consistency of brand, and all that kind of thing. But you're talking even about something even more mundane, just consistency of address, consistency of phone number, of website, of actual location on a
Yeah.
map.
Yeah.
If you don't have consistency there, you will erode trust, as you said, very, very quickly with your patients.
Absolutely. Yeah. So you can get as high level as brand or tone of voice, but you can get as granular as, like you said, phone number, which from my experience has been a huge issue for healthcare providers, because there are so many phone numbers for different offices and extensions and different providers. And is it the patient's responsibility to make sure they get the right one and keep all those numbers organized? No, it's the healthcare system's responsibility to get that good quality information to the patient when they need it.
And Drew, is that part of the challenge here? Is that there are so many phone numbers, there are so many different ways, and different departments I find in healthcare organizations have different protocols when it comes to booking an appointment or how patients reach out. Some people are like, no, 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 portal first. And other parts of the organization may go, no, 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 call first, right? And then yet another one could be, go app first, right? Is that part of that consistency challenge that you're talking about? And
Yeah, and I think it's a mix of all of the above. I mean, people in the car driving and going, I wonder if I should look up more information about, for simple terms, an ache or a pain or something. They're going to jump online. They're going to Google it. Where do you show up in Google, number one, with SEO to begin your marketing journey, to begin that interaction? Then looking on their phone, and is the website experience going to be consistent enough? Are the buttons going to be big enough? Is it going to be accessible to people that have vision issues? That carries right on into the website itself, that website experience, because they're going to end up going to that maybe the next day to go, okay, now I need to lock in that appointment. Now I'm sitting at my desk. I'm going to look it up on their website. You don't want to have buttons in a different spot. You don't want to have your navigation in a completely different schema where I don't know where I'm at. Am I even on the same website again? You want to have it consistent, almost anchored, where they know exactly where to go every time they get on there without switching it around on them.
Right. So there's sort of this consistency element that we've been talking about, but you're also now bringing in this sort of intuitive element here, where you're talking about making things easy and simple, and I guess you say conforming to the norm. So I know that, clicking on the three little horizontal bars, that's going to drop down a menu and those kinds of things. Am I getting you right there? Like, you got to make these interfaces very intuitive for people to actually want to use them.
That is exactly it. Just creating that consistent experience through the UX, UI, that whole journey that that patient or that customer, that visitor sees, optimizing that mobile so it's just works great on their smartphone. It responds correctly on their smartphone. That's even before you get into things like accessibility and things about multi-language, or localization using the appropriate cultural terms, or modifying images or colors or symbols so it's culturally appropriate to what their language is and where they're coming from.
So I want to hear you on this one. Like, what are some of the things that you've seen through either your work in healthcare or outside of healthcare that can be done to make these digital interactions much more intuitive for the user?
Yeah, I think there's there's an aspect of this where multiple parties are involved in delivering a great customer experience. So there's the healthcare system, the marketing team that works for them, understanding what the needs of their patient population are. What are the challenges? Where have people given feedback, and the marketing team knows this is where they need to make improvements, or where are there opportunities to maybe be ahead of the curve and engage with those patients in a new way. Then there's the implementation team that helps to create these maybe tools or platforms that the marketing team uses. And then there's the vendors, right? And we all know that for electronic medical records, there's big vendors out there that many people are familiar with. There's vendors in the digital experience platform space, in the analytics space. Well, these vendors need to create tools and platforms that the marketers can use. The implementation teams, like Drew's team at BizStream, they understand how to make sure that the customer experience is accessible and meets accessibility guidelines. And then the marketing team, they know the strategy. So you bring all these things together, and that's how you deliver a great customer experience or a great patient experience to that patient population.
So what I'm hearing from both of you are a couple things here. I'm just going to summarize quickly. You guys are saying, hey, listen, changing colors, localization of language, terminology, culture appropriate, those are things that you can maybe aspire to. You got to get some of this fundamental stuff consistent first, in terms of, the phone number, the locations, those kinds of things. Once you get your arms around that, then you can move to these, I'll call it the higher level stuff. There's no real point in being culturally appropriate if you've got 6 different phone numbers for your same office, right?
Yeah.
That's what I hear you say. And then also, you've got to make these experiences very, very seamless, so that when you come back to the app from the website, it's not completely different. The menus are in a different spot, and they're not labeled differently. So it sounds like there's a lot of very simple things that organizations can do to just improve their overall digital experiences without having to go and rip out anything and implement new technologies.
Yeah, exactly. There's a lot of the basics, like you said, those fundamentals that can be driven right from the beginning to address who your personas are. You know who your personas that are hitting the website is. How are they going to act? How are they going to react to this? Where should you have that navigation? What language should it be in? What's the accessibility for that patient or that visitor?
Yeah,
So,
and if we
go ahead.
assume that the marketing team knows what they want to accomplish, they know what their goals are, what their challenges are, uh, there are many things that team could do to improve the customer experience, but they only have so much time during the day. So every decision they make of what to tackle is an opportunity cost of the things that they don't have time for. So a question comes of, what are you prioritizing? Because maybe there is something like a marketing team goes into the website in the back end with whatever platform or tool they're using, and they do change some colors. Okay, how much time did that take them? And did that prevent them from doing something else, maybe of higher value? So it's not that the marketing team is incapable of doing much. And in fact, they're capable of doing a lot. It's really deciding where their value or where their effort brings the most value to the patients. So, from my perspective on the vendor side, doing something like changing colors, but I don't think they should be focused on something like that. And instead, maybe making sure that those phone numbers are correct is more valuable. But also that, if you think about it, it's kind of like busy work if you're just going around a website and checking to make sure phone numbers are correct on every single page. So having a platform or a tool that makes that easy or even a non-issue, that lets the marketing team then kind of move up in their priority to the things that are really important that the marketing team really specializes in, which is, figuring out what the patient journey is through the website. How do we make sure that someone that's searching for an oncology healthcare provider is able to get to a selection or a search experience for oncology providers within that healthcare system quickly in the fewest number of steps, while also making sure that website or app experience doesn't prevent someone from just getting to the primary care physician offices if that's the information they need, right? And you have all these competing interests. The marketing team really is able to, I think, bring a lot of value in finding solutions to those types of challenges instead of going through 100 web pages and checking all the phone numbers, or changing the navigation background color to blue instead of light blue, right? Those types of problems have been solved a long time ago with more modern tools and approaches to these types of challenges.
I like it. I like it. And let me ask the both of you: is this the kind of work that you do as BizStream and Kentico with healthcare clients? Is this sort of you helping them kind of do this assessment, help them assess and prioritize the projects so that they're really kind of focusing on the right things or valuable things versus, changing a background color here or there?
Yeah, working with them to build that strategy, that overall infrastructure strategy, the information architecture, if you will. How is this going to roll out? Who is this going to affect? Who are the stakeholders that are going to be involved with this? And to really roll out a solution to be able to have their content be built once, delivered anywhere that they want. Like to Sean's point, you don't have to keep worrying about, I got to change it here, I got to change it here. You got 15 different places to change it. It just elevated it by having a more dynamic tool set that has that built in already. That's where we come in and implement that, really look at those overarching goals to implement a strategy that's going to work for them.
Yeah, and digital agencies like Drew's focus much more on interfacing directly with the marketing team and understanding with them how to solve challenges for that patient population. Whereas on the vendor side, like myself, we are focused more on the marketer's day-to-day operations and much less so on the patient's experience. We let the marketers manage that because they know their patient population. They know what types of experiences will benefit those patients, and they work directly with someone like Drew to make sure that that's a successful rollout of whatever they're building. But on the vendor side, we think more about how do we accelerate a marketer's day-to-day operations, the types of things that marketers, no matter what your vertical or your industry is, how do we accelerate them to be able to get more done so that maybe busy work just kind of fades away in the background or disappears completely. And instead, the tool or the platform can really help them focus on those high value tasks.
Are you guys able to share some examples of some of the work that you've done, just so I can have it concrete, and listeners and viewers of this can also have that sort of concrete image in their minds?
Yeah, absolutely. Recently, we had the opportunity to work with I'll keep it kind of generic, large healthcare system that was in the upper Midwest. They had 70 locations throughout the Midwest, and they had a ton of information. They had new branding. They wanted us to come in and kind of look at, we went in, we looked at what their overarching goals are, what they're trying to do. Information was key. Patients and visitors that go there, they want to find that information ASAP. What we ended up doing is building a more robust search engine on the back end of it, leveraging the search engine from Azure, building that in to make it multifaceted and integrating it with their mobile app and their website so people can actually look up the information much, much quicker, much faster, and much more accurately than what it was before. It was kind of I don't want to say it was a dumping ground, but it was kind of chaotic before. But really streamlining that experience to where I want to get in, I want to find my information I'm looking for and get out and know exactly where I need to go next. We built that and added their brand colors and just built a beautiful experience to where that visitor knows exactly how to get in there without having multiple layers of navigation that's in there. It was just kind of a direct in, direct out. And it increased their performance score by 30 or 35% in the end. They were very pleased with it and reduced that duplicative content along the way.
And when you mean that 30%, like, was that just 30% faster? Was it 30% more, 30% higher, patient
Yeah, I should say
satisfaction with it?
it was 30% higher patient interaction with it. Because of the experience of it, a lot of people, a lot of the visitors noticed the difference and the power that was behind it, and they were easier to find what they wanted to do. It just got better results from that. They had a lot more patient engagement. Directly what we're talking about just outlined the need for having that search to increase that patient engagement. The patients were happier and visitors were much happier using the website.
And you have to believe that that would also reduce the burden on the staff, right? Because if you're not able to find the information online or through some means like that, or through some self-serve mean, that usually mean you pick up the phone or you're reaching out by email or you're going to the portal and doing something and then causing other downstream work to happen. And so if you're able to increase by 30%, that, to me, that means that's 30% less work for someone else to
Yeah,
do.
exactly. Empower the visitor and the user to find what they need and do what they need to do on that website or on that application.
In healthcare, and this is common in many industries, but healthcare in particular, because how it's evolved over time, digitizing over the past, let's say, 20 years, with electronic medical records kind of revolutionizing the industry. There have been kind of like a patchwork of internal systems that these healthcare organizations use. And there's always the question of what's the source of truth, whether that's for provider profiles or information about offices, like locations, or maybe taxonomies that providers treat or that are serviced at different locations. Where does that information come from? Is it coming from Epic? Okay, maybe some of it, but really, is that information appropriate for a patient? No, that's really meant for internal use within the healthcare system. So if you were to just take that Epic data and dump it out onto a website, I guarantee you're not going to have a great patient experience. Okay. But some of it is useful, right? And you probably have information from these other internal systems that have been built and worked on over time within the healthcare system that do have some useful information. And you want to take different pieces and parts of this and put this in the web experience or maybe in the mobile app experience. It's up to the marketer to define which pieces of information are going to be displayed, because they're the ones that are conceptualizing what that patient experience is. So this means you need to integrate this kind of portfolio of internal systems into a website or into a mobile app to get that information out there. And I've seen it be a huge challenge for marketing teams to even understand what's available to them, what's being pushed where, what is the source of truth, how do they customize that integration of data and content for the patient experience. And so you kind of need a system, and this is where, from the vendor side, we're thinking more about what can we enable for that marketing team rather than necessarily the patients, because the marketing team is deciding what the patient experience is. We're going to help with the marketer experience. How do we allow that marketing team to get that information into their web experience that they're managing? Well, you need a platform that's customizable, that can integrate not just with modern internet-based products and services that maybe were created in the last 5 years and use all the latest technology. You need something that can integrate with that kind of old, crufty system that has a lot of important information in it internally. You need to be able to get that data out and get it into that website so that marketers aren't copying and pasting. And that integration might not be the most beautiful thing you've ever seen, but it needs to be possible. Otherwise, you could be asking internal IT team to spend hundreds of thousands to get data in a certain way if that customization isn't easy to make happen, if that integration is impossible.
And I like two things I'm keying in on that you said. One, you said EHRs have revolutionized the industry. That's funny and a pretty interesting comment. I love it. And the second thing, old and crusty, when referring to those similar legacy systems, because I think that is what most people have in their mind when they think about a healthcare system. But no, you are absolutely right. Love those comments. I'm gonna go back to you, Sean, on just something else that just it ever since you got online, I've just had in the back of my brain here. Because you as an organization deal with uh, industries outside of healthcare, we've seen, for example, a huge consumerism wave hit healthcare, and that's born of all the experiences and things that are happening outside of healthcare that we're now used to in the hospitality, the travel, the retail. What are you seeing, Sean, that is happening maybe in other areas of our lives that healthcare should be ready for when that wave inevitably hits us? Like, is there anything you're seeing, like, boy, hey, like healthcare better get on this over the next couple of years because the expectation's already there from these other places? Is there anything like that that you're seeing?
Yeah, absolutely. And some of these things, Drew and I have kind of touched on already, like multi-channel, right? You want to be able to reach the patient no matter where they are. And this is common if you use online commerce, which I'm sure we all do, use something like Amazon or Target or whatever. You want to be able to engage with that brand and whatever they provide you through whatever device, electronic device or channel you have access to. And that's the expectation that people have on the consumer side. And rightly or wrongly, they're going to bring that expectation to healthcare as well. There's also things that are much more on the technology side that have an impact on what the patient experiences, but things like AI, chatbots, right? Things like personalization. These are big in other industries where maybe there is less regulation. And it makes sense why there would be, because the impact of these technologies, the positive impact is great, and the potential negative impact is much lower than maybe it is in healthcare. And so I think it's important for marketers to at least be aware of these things, because eventually they will come to the healthcare space. They will probably look and feel different, especially from the marketer's perspective. How they can use these tools is not going to be exactly the same as if you were just running a big commerce site, or maybe the digital side of a big box store. On that healthcare side of things, there's a lot more to think about, a lot more to be careful about, but also a lot of opportunities to provide that great patient experience. If I'm a patient, I go to my let's say my utility company, and there's something going on, there's an outage, I can get on a chatbot or something on the website really quickly, and they tell me that, oh yeah, the technicians are on their way, things will be repaired in the next 15 minutes. Oh, great. Great experience for me. What is the equivalent of that in the healthcare space? And is there something that we need to think about differently to tailor it to healthcare, and maybe the expectations that patients will bring to healthcare as well? Because I might not want to just start chatting with someone through a chatbot about a sensitive topic. Maybe something does need to be a bit more formalized, or maybe in person, but there's probably a way that AI or chat or personalization can help with that.
Hit on that in a minute, but Drew, over to you. What are some of the things that you're seeing that uh, healthcare should be keeping their eye on in terms of digital experiences and patient expectations down the road?
A lot of what Sean even just said, where it's that seamless multi-channel communication, because you're going to get hit on social media, you're going to get hit on mobile, you're going to hit on web. You have to make sure that those are all seamlessly working together. That's a big one right there. And I echo 100% the consumerism part of people that are on Amazon. I mean, everybody uses Amazon at this point. I'm not gonna, when I order something, I don't want to wait 2 days to get it now. It used to be you get it in a week, it was amazing. Then it was 2 days. Now it's like, I want to get it today. I want to know now. And I think that is just catering through to every other industry that we've seen, that how do I get a cleaner, better, faster to everybody, and much more accurate as well? How do I keep that experience going so people don't get frustrated and leave and go, well, I'm going to find somebody else that can get me the answer faster. I think the speed of delivery is a big one.
I love it. And I have to end by asking both of you this question because, we're living in that age, but where does AI fit into all of this?
Yes.
Right? I know, Sean, you mentioned it kind of in your chatbot statement, but Drew, I'm curious, like, how is AI baking into all of this and affecting all of this?
And you and I have talked about AI before at another podcast, and I can talk for hours on it. I am just enamored with AI. I think some of the biggest things that we already are seeing and where it's just going to expand is virtual assistants. More of the you could do it with GPT-based chatbots on your system that handles any kind of patient inquiry. It's 24/7 at that point, providing any answers about symptoms, medication instructions, or maybe it's scheduling or basic health information. Um, I think those are going to grow, and I think you're already seeing when you meet with a doctor now. A lot of times they'll pull out their iPhone and ask you, "Is it okay if I leave my phone on?" I actually have an AI recording system that's going to take all of those notes. And I've already talked to some of these doctors where they're saying, "I'm getting 2 hours of my life a day back because I don't have to go back and type up all these notes." And talk about accuracy. People say, AI is not completely accurate. It's getting to the point where it's exceeding human expectation, where we're not completely accurate. If we have to go back 3 4 hours later and go, what did we talk about exactly? I want to make sure I capture all that later. And that's been a challenge for a lot of physicians and a lot of doctors to really capture a lot of that. So keep moving that forward. How does that work in the digital marketing realm? Again, going back to chatbots, having that accessible right now effect to it. And really, I think building LLMs that can large language models that can handle clinical data analysis and really drill down some of those large data sets of the medical literature and research papers and several different areas of data to really distill that down faster than what we can do.
John, over to you.
Now, having members of my family in healthcare, the prospect of AI having a positive impact on concurrent documentation is very exciting to me and the people I care about, because I know how much of an impact it would have on their lives. I also think that that's something that is going to take some time to figure out how that all works. But from my perspective on the vendor side, I think AI can have a positive impact on the marketers and their day-to-day operations in much simpler ways. So in a product like what we offer at Kentico, being able to upload, for example, pictures of the new location, new healthcare location that just opened up as a new maybe urgent care clinic, and there's multiple pictures of the building and the parking, and you want that information available to patients so they have an idea of what they're going to drive to and where they can park their car, and are the entrances to the building accessible, things like this. Okay, as a marketer, I want to just be able to grab those images, upload them, have them optimized so that they're going to be served quickly on the website. Maybe people have spotty connections or maybe slower, older phones, especially with an older healthcare population. These are reasonable expectations to have. I want to be able to just upload the images. They have alt text on the website, so it's accessible. They're optimized, so they download quickly. If let's say there was a picture of a healthcare provider team out in front of the office, wouldn't it be great if AI could just crop that image, focused in on the people's smiling faces, and have a nice background centered on those people? And I'm just able to upload the image, and the system, the platform, AI takes care of it for me. I get to review those changes because, of course, content governance is really important for a marketing team. And then everything looks good. I publish them out, and it's live across all my digital channels immediately. This is an area where maybe it's one part of the process, but AI can just give me minutes or hours back in my day where it's working as a tool to accelerate me and the things I need to do. Again, like I mentioned earlier, taking away some of the little busy work tasks and letting me focus more on the higher level, important, valuable things.
Again, I like what you said there, Sean. AI is a tool that accelerates me, right? Like that is where I think where it can be most valuable right now is like in those we think it might be little, but it's not really that little. Like
Yeah.
just doing a lot of the things that would just be so time consuming and tedious, and frankly not worth the calories. We
Yeah.
could be spending it on other more important things. That opportunity cost that you brought up way back at the beginning of our conversation. I love all of that. And then like we can get more advanced, Drew, to the things you're talking about and mention, like AI agents and those kinds of things where it's 24/7 being able to answer the questions at any time. And, even if it's not symptom type stuff today, because I still think there's maybe some trust issues around that, but simple things about like, where should I park? And, do I have to have what are the instructions for the physiotherapy that you told me about? Or what's the website that I should go to? Cause I can't remember that you told me, right? And am I allowed to have this, but not this with this medication as I prepare for my visit? Those kinds of questions. I don't think anybody has a problem of saying, hey, like an AI can handle that at 12:30 in the morning when you suddenly wake up and going, I can't remember what the instructions were. Right. So I love all of that. I love it. We're running to the end of time here, but I want to make sure I ask this question. Sean, where can people go to learn more about Kentico?
Yeah. So the best place to go is going to be our website, Kentico.com. That's KENTICO.com. And you can find out all about the types of tools and services that we provide for marketers to help accelerate them and help them do their jobs better.
And Drew, same question. Where can people go to learn more about BizStream?
Not surprisingly, on my end, it's our website, BizStream.com. Yeah, you can find all our capabilities, our services. I always tell people it's always worth the first conversation. Conversations are free. Let's talk. Let's see what you're trying to do.
Awesome. Well, thank you to both of you for being on the program today. It was wonderful to have this conversation, and thanks so much for the information you shared.
Thanks,
Thanks for
Colin.
having us.
Hey, I want to thank Drew and Sean for joining me on the program today. I appreciated that they stressed how important personalization is to the overall patient experience. There is nothing worse than being treated like a number or an entry in a database. If you enjoyed this interview, please mash that like button and click subscribe. Also, head over to Sway Health, that's Sway with 2 A's, .health, where you will find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next episode.